I am thankful for the opportunity to share and explore with you today. Before we begin, I want you all to recall your happiest experience from your early 20s. Whether that was you getting your first job, graduating from college, or even getting your first apartment. Can you see it? Can you feel it? Now I want you to recall your most unhappy experience from your early 20s. Potentially a struggling friendship, a stressful romantic relationship, navigating your own mental health, or even a tumultuous family dynamic. Can you see it? Can you feel it? Let's step back and consider who was there to support you through both your happiest and your most unhappy experiences from your early 20s. Was this person or persons able to understand what you were going through? Did they share similar lived experiences? And lastly, did they look like you? I can recall when I was in my early 20s and my most happy and unhappy experiences. I vividly remember my mother searching high and low to look for resources to support me through these experiences. I had outstanding coaches, amazing school teachers, and terrific school administrators. Unfortunately, I did not have somebody that looked like me to offer me that clinical perspective to help me process my thoughts, feelings, and emotions. If you were to ask an African American man or an African American boy, both struggling to navigate their own mental health, if they've spoken to a therapist that looks like them, disproportionately, many would say no. This is not out of choice, but out of a lack of representation in the fields of counseling, psychology, and social work. The American Psychological Association explored their 2021 demographic data of their psychology workforce and reported that only a shocking 5% identified as Black or African American. Of that 5%, only 17% identified as Black or African American men. For context, this means that 1 out of every 100 workers identified as Black or African American men. Zippia.com collects job data from the Census Bureau and the Bureau of Labor and Statistics, and in 2021 reported that only 4% of therapists in the United States identified as Black or African American. Again, some context, this means 4 out of every 100 therapists in the country identified as Black or African American. This brings me to today's topic. Research has shown and proven that there's a crucial shortage of Black male therapists within the field. The presence of Black male therapists is vital as they contribute to fostering a more inclusive, empathetic, and effective approach to clients that look like them. Representation of mental health therapists that are Black can help to transform the stigma of mental health within the Black community, not only for youth, but for adults. The underrepresentation of Black mental health professionals is an alarming statistic that requires immediate and concrete change. In the next few minutes, I will offer you some thought-provoking steps to increasing the number of Black male therapists in the field, while also working to identify some tenets of concern for Black male clients. I believe that with a lack of representation in the field, Black boys and Black men will continue to underutilize mental health services. Breaking the stigma and encouraging help-seeking behavior has been a continued struggle within the Black community. A study from the Behavioral Medicine Journal in 2016 by Pohl and others shared that between everyday racism and perceived racism, alongside internalized masculinity norms, continues to impact Black men's reluctance to seek medical help. Bloomberg and others 2015 go on to state that only 26.4% of Black and Hispanic men ages 18 to 44 who were experiencing signs and symptoms of anxiety and depression were willing to seek medical help, as compared to 45.4% of non-Hispanic white men ages 18 to 44 who were experiencing the same exact feelings. Transforming the mental health landscape is going to require representation and role modeling by both clients and clinicians in order to shift that narrative. Black male therapists serve as role models, challenging that underrepresentation of Black mental health professionals within the field. Representation matters because then we can talk about empowering other individuals to envision positive outcomes for themselves. Think about it. Seeing someone that looks like you in a position of authority and compassion allows you to consider the idea and other individuals to pursue a career in that field or to seek help without fear of judgment. Black men will continue to underutilize mental health services in part due to the fact of not seeing many or any Black male therapists in the field. This is a major reason why I chose to pursue a career in the field, not only as a disruptor to break the stigma, but as a catalyst to support those interested in a career or those seeking help. A national study in the National Library of Medicine by Sue and others, 2009, shared that there were well-documented health disparities between ethnic and racial minority groups, as well as nationally publicized studies regarding cultural bias in healthcare decision-making and recommendations. The evidence of this study went on to share that mental health services were less accessible, less available, and less effectively delivered to these populations. Sue and others, 2009, went on to state that ethnic and racial minority groups continue to receive a lower quality of care, less access to care, and are less likely to receive state-of-the-art treatment. Consider, if you will, a Black man struggling with what he perceives to be racism in the workplace. This issue has begun to impact his day-to-day responsibilities and his personal well-being. He hears that therapy is amazing and he decides he wants to give it a try. He calls, he signs up, he walks in, he sits down, and then he realizes his therapist is of a different race. How do we expect this Black man to share his candid thoughts, feelings, and emotions around the subject of racism? Can he trust his therapist? Can he share the entire story? Will the therapist understand what he's going through? Or will he begin to edit himself as to not make the therapist feel uncomfortable because they can't understand? You see, the intersectionality of the Black man, his experiences, and his struggles is not something that a textbook can help you to really feel, learn, or to understand. These experiences come from unspoken understanding of trials and tribulations of an entire race and culture, and more specifically, the men in that race and culture. Cultural competence is vital in understanding the nuances of this experience related to race, identity, and societal pressures. Having a therapist with similar cultural backgrounds can lead to a more relatable therapeutic relationship, which can then increase to better high-quality medical care. Now, I know you may say that this seems too vast, but it's not. Transforming the mental health landscape can require us showing up as our true and authentic selves in all spaces. Whether there's space there or not should not be our concern. Our focus should be on dismantling the system and then increasing representation within the field. Here's my three-pronged approach to how we dismantle that system. First, let's educate our students. Black male therapists can shatter stereotypes and show that there's diversity within the mental health field and profession. Black male therapists can inspire students, showing them that they too can excel in spaces despite the societal barriers and the stigmas. The representation of Black male therapists can lead to a sense of validation and belonging for students that have typically felt marginalized or underrepresented in traditional career paths. When we highlight the achievements and the impact of Black male therapists, we can create an idea where we're dismissing and decreasing misconceptions and increasing validity of them in the field. When we follow these steps, then we can get to a point where students are now understanding the idea of mental health from an individual standpoint and a community-related standpoint. Second, let's create and provide mental health graduate school programs that focus on promotion, attrition, and recruitment of Black male therapists. These programs should have a fervent focus on the idea of social justice, African American psychology, and authenticity. By providing this level of safe space for students, we not only educate them out of a strictly Eurocentric point of view, but we also have them work on embodying what their identity is for when they step into the mental health profession. A great example of this type of environment would be prestigious programs across the country at historically Black colleges and universities. Last, let's ensure culturally competent supervision. I have the esteemed pleasure to be able to show up as a clinical supervisor for up and coming master's level students and therapists still in the field that are looking for further support. Would you believe that just as we talk about clients needing representation, therapists need and want that too? Clinical supervision should be a space where you're able to learn, to grow, and to find your rhythm. If you took a small poll of the few Black male therapists that are in the field, you'd find that they typically run into forms of racism, isolation, the forced requirement to code switch, and even microaggressions while in clinical supervision and clinical settings. Culturally competent clinical supervision should be a space where we're increasing psychological safety and decreasing imposter syndrome in order to provide a more theoretically sound therapist and place of work for them to grow in. Imagine, if you will, a therapist so comfortable in their own identity that it allows their clients to show up as their true and authentic selves. Shouldn't this be the basis of true cultural competency? Consider the idea of a Black man or a Black boy coming into a mental health session and being able to bring their entire self with every facet of life that they are experiencing and that they're going through. Sitting across the room or on the screen with somebody that actually understands what their experiences are. Now, you may believe that this lack of representation does not impact you, but I implore you to consider the idea of empathy. Think about your husband. Think about your son, your father, your boyfriend, or even just your friend. Regardless of their identity, their race, or their intersectionality, do they not deserve someone that truly understands them? Someone that can respect their cultural backgrounds and experiences, honor their real life experiences, and then also be able to provide clinical feedback from a perspective to support them through these situations? Not only should this be a requirement within the mental health system ethically for the United States, but a societal one that requires more trailblazing work around the world. We can do more for Black men and Black boys' mental health. Thank you.